How many of you have ever been nervous? I'm sure we can all recall a time where we've been worried or apprehensive about something, whether it be before a big test, or a big job interview, or even saying the speech right now. But anxiety and panic attacks are something much different than that. They even differ from each other. According to the ADA, also known as the Anxiety and Depression Association of America, panic attacks are defined as the abrupt onset of intense fear or discomfort that reaches a peak within minutes. The symptoms can include accelerated heart rate, dizziness, nausea, shaking or trembling, shortness of breath, chest pains, even the fear of dying. Anxiety is a feeling of worry or uneasiness that happens before an event or a certain outcome or even day-to-day activities. I know that panic attacks have affected millions of people all over the world. It even has affected me. I would wake up every morning with a stomach ache because I was nervous about the day. My intense anxiety then led to panic attacks, which I eventually learned to control. Although panic attacks and anxiety can be frightening to face, there are multiple ways to combat the symptoms and ease your mind, as well as many options for seeking professional help. Panic attacks and anxiety differ from each other due to the variety of intensities and duration of the symptoms. Panic attacks usually last about 10 minutes or shorter depending on the person, and during the duration of the attack, the symptoms will reach their peak. Panic attacks can often occur during times when an individual is in an anxious state or even when the person's at a calm state. Due to the symptoms becoming intense during panic attacks, they often feel as though that they're going to have a heart attack or they have some sort of breathing disorder, which is why a lot of people go to the hospital because they believe that they're going to die. Those who have intense panic attacks often get anxiety that they're going to have a new one, which begins to affect how they live their life. Individuals will stop going certain places or doing certain things because they are afraid that they're going to have another panic attack. Although you often feel alone and that no one understands what it's like to have a panic attack, or it feels like you're getting anxious during regular activities like going to the grocery store or walking to class, panic attacks are experienced by millions of people. According to the ADA, anxiety disorders are the most common mental illness in the United States, affecting over 40 million adults. GAD, also known as generalized anxiety disorder, affects about 6.8 million adults. Panic disorders affect 6 million adults, which represents 2.7% of the United States population. Then there's social anxiety, and that affects 15 million adults, and it's equally common between men and women. And then social anxiety usually begins around the age of 13, and it usually takes 10 years of people experiencing the symptoms before they actually seek help. When a panic attack or anxiety begins to occur, there are many ways to stop it, or make it easy to handle. According to Healthline.com, they listed many ways to stop panic attacks, which I found helpful for myself. One is to use deep breathing. It helps prevent you from hyperventilation and reduces other symptoms. 2 is to recognize that you're having a panic attack and that it's only temporary. It is important to realize that you're not going to die and that the feeling will soon pass. 3 is to picture a happy place, somewhere that you wish you were or someone that you wish you were with. This will help keep you distracted and relax your mind and all your breathing patterns. Now 4 sounds a little weird, but it's to keep lavender near you. This is known to be a stress reliever scent and can help relax your body when you're having a panic attack. According to healthguide.org, there are many ways that you could seek or obtain help for panic attacks and anxiety disorders. You can seek therapy, which will help an individual realize why this is happening to them and ways to fix it and ways to change their behavior in the whole. And then individuals can also take medication like Xanax because they're anti-anxiety drugs. Although it may be hard to admit to have anxiety or panic attacks, it is nothing to be ashamed of. And if you're struggling with it and it's affecting your day-to-day life, it's really important to seek help and talk to your doctor about proper steps to treat it. Panic attacks are scary and affect people all over the world, but it is our job to spread awareness about these disorders and help others seek appropriate treatment. Thank you. Show people. Hi.